I'm Scott Weese. I'm an infectious disease veterinarian from Canada, and I just came from the GLG-ESCMID session on antimicrobial resistance. So the GLG is the Global Leaders Group on Antimicrobial Resistance. It's a quadripartite group that's come together to help move the agenda on antimicrobial resistance in a variety of ways, especially internationally, trying to get more attention, more funding, more focus on this global but silent pandemic of antimicrobial resistance. So a goal for today was to work on forging partnerships, and there are a lot of partnerships that need to be achieved to have an effect with antimicrobial resistance, and that might be across the One Health continuum between human, animal, environmental sciences. It's between people that deal clinically in research, economists, social scientists, the whole range. It's what we call a wicked problem, one that kind of encompasses a lot of areas and doesn't have a simple answer. We need to engage a wide range of different expertise if we're going to have any chance of addressing this. Today's meeting was great. I think we had good energy, we had good interest. I think we had some recognition of the complexity of the problem. And part of it is moving forward, and part of it is realizing the challenges that we have, because there isn't a simple answer to this. So as we get more energy, as we get more understanding and realize what we need to do to move forward, it's going to be better than trying to do this in a silo like we often have tried to in the past. The big question is, does a meeting lead to anything, right? We've all had meetings where we've had great ideas, and then we've met the next year or 5 years later and had the same great ideas, and nothing's happened in the interim. And we've had this problem with antimicrobial resistance too. We know what we need to do, and we haven't been able to get that into action many times. And I think we're seeing a change in that now. We've got this wide interest in it and this wide interdisciplinary interest, and the realization that we have to tackle this as a broad interdisciplinary, intersectoral problem. So I think we do see a lot more movement now and a lot more potential than we had in the past. I think for me, as someone that works in the veterinary side, one of the big things is very similar. A lot of the challenges that we identified in the human side and the veterinary side were very similar, and the opportunities are very similar. I think we need to realize that and move forward together in parallel as opposed to this separate approach like we've done in the past.